Pleasure talking to you, speaking to you.
Absolutely. Thanks for spending this time.
No, of course, this is important. How's everything going?
We're doing okay, man.
Yeah,
Safe at home. Family's fine so far.
yeah.
Yeah.
Same here, same here.
You?
Me and the family out here in Portland, so we just kind of trying to stay safe and trying to stay away for it from right now to see everything just calm down and see what this takes us.
Yeah, man. I just hope this thing gets over, but it's just so many things we just don't know.
Yeah,
But it's what it is.
yeah. So I'm, Doc. I had a couple of questions for you, Doc.
Okay.
First off, I just want to say thank you for kind of just doing this and bringing awareness and giving us information that kind of our people of color don't really get a chance to have this information or have access to get this information, right? So we're in a situation where we don't really know what to believe, what not to believe, who to listen to, what to listen to, how to listen to it. So I just have a couple questions that I would like to ask you. Just for starters, I remember you mentioned the confusion between what research is known to be true versus what the media is sharing about how the African community is impacted by COVID-19. Could you clarify that? Could you break that down? How research is collected and just where these statistics come from?
Yeah, well, the interesting thing is that the hospitals and the doctors and every community has a local health department, and they collect a variety of pieces of data. They collect the tests that are done, the number of people that are sick, and they get reported. They get reported at the local level, usually city, county. Then that goes to the state, and as you can imagine, it goes from the state to the feds. And they put all that data together. And the challenge is it takes time for that to happen. Unlike Amazon and the grocery store, and most of us, the systems aren't designed for instantaneous information. And this disease is, we're learning a lot about it. It's new, and so some of the stuff I said in the morning may not necessarily be the same at night. So I'm having to be careful what I say.
Yeah.
And so that helps people be confused, unfortunately. But I think that what folks ought to understand is that this is an evolving situation, and they ought to figure out who to trust and pay attention to the people that are trusting, understanding that information can change over time.
Yeah, I think I say our community, we want to know so much information, right? We want information that's going to make us feel good about being able to make the decisions that we want to make, right? Whether it's staying safe, ourselves, our family, friends. We see over the past couple of weeks how impactful that COVID-19 has been in the African community. The topic of like pre-existing conditions, like amplifiers and and putting our community at risk, and it ties to long-standing classism, racism, lack of healthcare, the trust in the healthcare system. Could you briefly speak on that?
Yeah, what we tell folks is, first of all, if you are 60 years of older and you have chronic diseases, and chronic diseases, diabetes, high blood pressure, heart disease, and I remind folks that even though the public and official line is if you're 60 or older, for us, 45 is the new 60, right?
Wow.
A lot of us got high blood pressure very young. A whole lot of us get diabetes very young. And so we should, if you have any of those diseases, you should realize you're more at risk if you get infected.
Right.
And I think the other thing that's most important is that so many of us have public-facing jobs, right? Bus drivers, store cashiers, working in the cleaners. A lot of those things are now considered essential businesses. Mm-hmm. So we're out in the public eye. So we have to be more concerned about protecting not ourselves, our families, and by the way, protecting each other.
Right.
When I go out, I need to make sure that I'm trying to protect the grocery store clerk by wearing my mask, making sure I wash my hands frequently so that I don't put them at risk myself.
Do you believe that we're not taking that as serious as we should? The safety precautions, right? The mask, the gloves and hand sanitizing and making sure everything is clean and safety. Like, do you think we're not taking advantage of that, or we're just whatever happened is going to happen, right? I know some people. I've talked to some people, and they're like, oh, it's not, well, we're good. Like we're good.
Yeah,
But
yeah,
you
yeah.
know, you still see floods and floods of people outside. You look at certain cities, you got everybody just outside hanging out. And you know, now even the latest is just people are starting to give up, right? People are starting to rally and just say they want to fight back. We need to be outside. We need to work, we need to be outside. This is enough. Let's figure this out. So that's what's kind of happening right now.
Well, you know, look, when I was 25 years old, I was invincible. Okay. All
You look good, Doc. You look
25-year-olds is
good, by the
invincible.
way.
Well, I'm 67 now. I ain't 25 anymore. And what we need to let folks know is, look, there was a lot of rumors about us being immune to this disease. That ain't true. Okay. And we're not only not invincible, but the evidence is, which we can see right in front of our eyes, is that like everything else, we're impacted more than folks that don't look like that. Okay.
Right.
Folks that don't have our experience. So we should take it seriously. Now, I understand that it's tired, and I understand that it's tough, but there are things you can do, right? You can walk around your neighborhood. You can walk around, you know, your house. You can walk in your house if you want to get some extra exercise. That's good. But you got to take it serious. And we know, I mean, we've been doing this public health stuff for, you know, a couple hundred years. The last time a big one like this hit was in 1918. And by the way, we went through this experience then. So we understand what we have to do, and we just have to educate folks to do this. Now, it ain't over, and it's going to be rough, but you know, we can take care of one another. We can talk to our families, we can talk to our friends, we can get grandma on the phone and make sure she's okay. There's lots of stuff we can do to protect ourselves, both in our homes and outside our homes. We just need to take this thing seriously.
Yeah, I agree with that. What about kids, the youth? Because there's this whole perception or misconception of whether kids can get it or they can't get it. Could you talk about that?
Yeah, you know, kids can get it. And like a lot of things, you know, kids are little germ factories. I love them. I got 3 grandkids, right? 8, 6, and 2. But they tend to do better at this than us older folks. And it's probably because their immune systems are better, right?
Yeah.
They have much more powerful immune systems, so they don't get as sick. But very young kids, particularly under the age of 1, and any kind of kid with, you know, who's on steroids for their asthma or has sickle cell anemia or has any other chronic disease, is probably more at risk because their immune systems, you know, aren't as functional as the healthiest of us. And so that, yeah, that's right. But you know, there's a lot of folks say that don't worry about the kids, but we got to worry about them too. So you got to protect your kids too.
Yeah. Is this do you think this is a class issue? Do you think that?
You know, money has always been a class issue, right?
True.
The more money you got, the bigger your house, the better you can social distance, you know, from one another, right? And I kind of get screwed up on the word social distance versus physical distancing.
Yeah, of course.
I really like that word physical distancing because I really want us to distance ourselves physically, but maintain social cohesion. And by the way, the Black community's always been very good at maintaining social cohesion, right? Whether it's, you know, family dinner or at a party, we understand
it. Of course. What is some of the like advice for communities of color like that you would be willing to share, you know, especially during this time and even, you know, past this time and beyond?
Well, I think first of all, recognize that we're still at risk and we are obviously, you know, cloistering ourselves at home, but make it a time for reading, engaging, you know, cleaning up your house, doing all the things that you don't have time to do, right? Because by the way, I have saved myself 2 hours a day because I don't drive to work or home. So I'm filling my time up trying to do something every day. I think everybody ought to do something for themselves every day. Everybody ought to pick an hour and say, this is my time to do something for me, not the job, not my family member, for me, so that people, when they get on your last nerve, you got some place to go, right? Second thing, recognize your kids are being traumatized by this. We may not see it, but you need to talk to your kids about what they're seeing, telling them that it's okay, putting your arm around them and hugging them, because they're hearing some crazy stuff on TV, right?
Oh, for sure, absolutely.
And so we got to protect them and understand what they hear, is a problem. Now, some of our kids live in communities where lots of violence and that kind of stuff, and this adds on top of that. And you need to know this stuff is additive.
Yeah.
And finally, the good public health messaging: washing your hands frequently, covering up your nose and mouth when you cough or sneeze. Understand how you're going to get health care. A lot of us don't have a primary care doctor, but you need to figure out if you get sick, how you're going to handle that.
Yeah.
And plan for that right now.
Got you. What so in layman's terms, right? Because I think our community, we hear all of these big terms about do this and do that, and just this big word might come up, right? Whatever the word is, it might come up to explain something so small. Like, what would be, I would say, like, what is the advice, right, for, as you stated when we opened up, like, how do we stay healthy? In the lamest terms, how do we stay healthy? Because people are afraid and people are scared, especially people of color. And as you see, they're protesting, they're marching, they're starting to, the pot is starting to boil you over right now, right? The water is starting to boil you, and as we've seen before, once the lid is taken off that pot, a lot of things can happen. So can you talk about that?
Yeah, first of all, physical health, eating 3 meals a day, exercising, even if you doing a few, whatever you can do at home, sit-ups, push-ups, walk around the house, whatever it takes, just so you don't become, the ultimate couch potato.
Yeah.
If you can get up and just walk around your house itself or your block with your mask. Now I'll come back to the mask in a moment. I think so good nutrition is still good and important. I also worry about your mental health. Again, I mentioned about just trying to relax and not, pay attention to some of the craziness around us. Eventually make sure that we will be able to get tested. Right now, it's only for people that are sick and people that are going to studies. That's important to do. The issue of masks, masking while black, is a problem still, right? And what I do, I'm not going to go into a bank wearing my mask as I walk in the door, right? I'm going to probably put it in my hand, wear it on top of my forehead, put it on when it's appropriate, stay 6 feet away from the next person, because that's the minimal distance you need to be to obviously protect yourself. And, just use your common sense, just like we would in the hood. Everybody, all of us grew up in the hood. We understand what it is to be in tough neighborhoods or relatively safe neighborhoods, and use your street sense and your common sense. And when you're online and someone sends you some information that doesn't sound like it makes a lot of sense, I can almost assure you it doesn't make a lot of sense. Check it before you pass it along. Go to a trusted source. By the way, the Center for Disease Control and Prevention, although they screwed up the test, is a trusted source.
Gotcha.
The health organization is a trusted source. And I work for the American Public Health Association at apha.org, and we think we're a trusted source. So those organizations that are important, NAACP, trusted source. Pay attention to those things. Urban League, trusted source.
Gotcha. You mentioned something which I was gonna ask you anyway. The mental state of people of color, just people in general, right? Could you talk about that? Because that's very important. Like, how would you tell people or recommend to people to stay mentally strong? Because I know there's days when I'm sitting here and I'm like, damn, like, this is really our new norm, right? This is life. Like, I find myself walking around and just thinking about all type of things, whether it's reflecting or whatever it is. Like, what would you say to people? What advice about just staying mentally strong and staying mentally prepared and just staying, on point? Because we can easily, like you said, it start with being a couch potato. It start by being, I'll do this later. You start pushing things back, and the next thing you know, you push it back one day, then it's the next week, then it's the next month, and then you still a couch potato at the end of the day. So what would you say to that?
Listen, stress is a real problem. All right. Stress causes heart attacks. Stress causes strokes. Stress causes depression. So get up every morning, make a plan. Decide, what am I going to do today? Okay. This is my day to accomplish X, Y, Z. What can I do to help somebody else today? X, Y, Z. Put it on a list and make sure you do it and check it off. Like I said, find some time every day just for you. Go into a room, sit there, be dark, and just think about something that's important that you care about. And we have a lot of us who have a mental illness, or have depression, or have seasonal sadness. And if you have that for yourself, make sure you get someone to help you. The clinics are still open. The doctors are still there. Don't stop taking your medicine. Take your medicine. And the button system, right? Call your best friend. Look, yesterday, a guy that I haven't talked to in about 8 years, I went to medical school with this guy. And he just picked up the phone and called me and said, "Hey, how you doing?" And I felt guilty that I ain't called him first.
Yeah, of course you did.
But, I'm gonna call him next week.
Right.
And I had done that for another friend. So call your friends, just check on them. By the way, assume your friends are sitting as lonely as you are. They're waiting for your call. Just give them a call.
All right, that's beautiful, Doc. I'm gonna let you go, Doc. Is anything you want to leave the people with? Anything you want to say? Websites, anything you want to let the people know they can go to get that information? They can talk to you, they can find you, they can listen to you, they can read what you're writing. You want to just give them that?
I'm gonna tell you, we're gonna get through this. We're gonna get through this together because we are strong people. We got through a whole lot of stuff over 100 and some years ago, right? So we can get through this. APHA.org is our website, American Public Health Association. The CDC.gov, another great website. Yeah, I know it's the federal government, but they got some good stuff there for you. Talk to Carmelo. He's got a site. Get on his site. He's there to help too.
I'm trying to take care of my people, man. I'm giving them as much information as I get. I'm just trying to share that to everybody.
Look, you're giving us the same spirit that you give us on the court. And I got to tell you, when folks heard I was going to talk to you, I'm a guy. So thank you.
I appreciate that, Doc.
All right, man.
Thank you, man. Thank you. Keep doing what you're doing.
All right. Bye-bye.
All right. Peace.
Peace.